and thank you for the warm welcome. So, 今天我主要是讲红斑狼疮它是怎么影响精神系统和神经系统的症状。So for the outline, we're going to go through a general background, the symptoms, and talk a little bit about some of the causes of lupus. We're going to go into the diagnosis and treatment, and then we'll end on the psychiatric component of lupus, which will be a great segue to the next talk. 今天我先讲背景，然后我们讲一下红斑狼疮的症状，它是怎么引起的，然后呢，怎么诊断和治疗，然后最后讲一下红斑狼疮是怎样影响精神。So one way to think about lupus is that it can affect all the organs, but it looks different in each patient. As you can see, it can affect the neurological system, including the brain. It can affect the kidney, the joints, also the skin and blood. So in each patient, your symptoms can be very different, and not all patients will present the same way. 红斑狼疮可以影响不同的器官，然后每个病人的红斑狼疮症状都不会是一样的。它可以影响脑部，可以影响关节，影响肾脏、皮肤，所以很难就是比较每个病人，他们不一定都一模一样。So just as a general background, so lupus is really an autoimmune disease of unknown cause. It leads to inflammations in multiple organs, and in some cases, it can lead to organ damage. It's important to remember and also to reduce the stigma is that lupus is not contagious at all. There are certain triggers of lupus, including genetic, hormonal, environmental. So sometimes often a virus can trigger lupus. And one of the most important thing is stress can trigger it as well. So part of this talk is about how to manage stress. Most of the lupus patients are actually women of childbearing age. So 90% of the cases are female between age 15 and 44. And there is 0.32 million cases of lupus in US alone in 2021. So it is a pretty common disease, and it's more common in Black, Native American, Hispanic, and Asian as compared to white. So 红斑狼疮是一种自身的免疫性病，而且原因不明，它会引起炎症，然后炎症呢有时候会引起器官损伤，但是呢我们得记住红斑狼疮并没有传染性，基因，然后呢有时候是病毒啊。就是环境啊和压力都会影响红斑狼疮的发展。大多数红斑狼疮的病人都是女性，90%，而且是比较年轻，15到44岁，但有时候也会看到50岁、60岁也会有。然后在2021年，美国32万的病例都是有红斑狼疮，他们经常是在黑人、西班牙人和亚洲人比起白人出现。So how does lupus affect the nervous system? So lupus can affect the central nervous system, which includes the brain and the spinal cord, or the peripheral nervous system, which includes the nerves and the ganglia. Your symptoms can be diffuse. So for example, brain fog or just a headache, or it can be more localized like a stroke. Oftentimes, most of the symptoms are actually mild, and only a very small majority rarely they can be severe. And 39 to 50% of the lupus patient can have a wide range of symptoms. And again, you can see a lot of these in Asian population. 这个红斑狼疮它是怎么影响精神系统呢？它可以会影响中枢系统，那就是脑部和这个脊髓，或者它可以影响这个旁边的系统，那就是你的神经。大多数的症状都不严重，少部分严重。大概30到50% 的红斑狼疮病人都会有一些症状，但是呢，而且在亚洲人会常见，但大多数都不严重。So let's talk about some of the symptoms of lupus affecting the nervous system. And again, some of them are not as severe and it may not be that obvious. So a lot of time the symptom is what they call feeling slow, and what patients say they feel like a brain fog. They can have small memory changes. They can have headache, anxiety and mood changes, or numbness and tingling in their hands and feet. One more of the severe symptom, which we sometimes rarely see in the hospital, includes seizure activity, stroke, a sudden change in personality, sudden confusion, or muscle weakness. 红斑狼疮它是怎么影响症状呢？大多数都是不严重的。那些症状一般就是他们感觉缓慢，或者他们发现记忆力没以前好了，有时候会头痛，或者就是焦虑，或者情绪有变化，或者手脚会麻木或刺痛。少部分是严重，严重的会有癫痫，或者是中风，或者性格改变，突然糊涂或手脚无力。一般这些严重的我们是在医院里面看到。And here is just the official list of all the neuropsychiatric syndrome. And you can see it ranges a lot. And it's divided into neurological versus psychiatric syndrome. So like what we talked about already, some of the neurological includes seizure, meningitis, demyelinating syndrome, stroke, headache, movement or spinal cord disorders, a lot of the nervous system disorders. The psychiatric syndrome includes anxiety, psychosis, being confused, cognitive dysfunction, or mood disorder. 你们看，这就是正规的这些神经和精神系统，他们会有假如脑膜炎、中风、头痛，或者是神经痛。然后在神经方面也有焦虑、神经病，或者是记忆不好、情绪变化。So this is a simplified way to think about what is causing the symptoms. What's the cause of the damage from someone with active lupus? So usually when people have active lupus affecting the nervous system, they also have other manifestation of lupus to give you clue that the lupus is active, such as joint pain or malar rash. And when they develop the disease, you can either cause inflammations in the organs, and inflammations is caused by autoantibodies, some of which are called ribosomal P, NMDA, aquaporin 4. These antibodies will go into the bloodstream and lead to a loss of blood and brain barrier and lead to some of the symptoms. Other ways it can cause symptoms is through clotting. So if patients also have antiphospholipid syndrome, they can get clottings and can get clots in the vessel walls and in the brain, leading to strokes. 我们看看这个红斑狼疮，如果在严重的境况下，他们是怎么创造伤害的原因和他们的病毒的病例的发展，他们可以弄脑部炎症，如果有脑部炎症呢，是有自身抗体的发展，然后呢就会把血脑炎就是退掉，或者呢他们可以my Chinese is not the best， 可以血髓形成，血髓形成的时候呢，你们就会有血栓的抗制药，就像 aspirin 或者就是anticoagulation like Coumadin， 然后呢，在这个时候呢，你也要血或者控制血脑的control。But I think it's really important when you're seeing a patient to keep a broad differential and think about that not all of the symptoms are from active lupus, and you want to rule out all the other causes before you treat them with medication that suppresses the immune system for the lupus. So oftentimes lupus patients can get infection that can also cause them to be confused, such as viral meningitis. Some of the confusion can also be side effects from medications, such as steroids can cause psychosis, and rarely Plaquenil and Belimumab can cause mood changes and depression. You want to rule out toxin or drug. For example, cocaine can lead to stroke and seizure. You want to differentiate, is this symptom from active lupus or this is a primary psychiatric disorder from childhood? Could the patients be anxious and have mood changes from the diagnosis rather than the lupus itself? 我们看病人的时候，我们就是说要记住，不是所有的症状都来自于红斑狼疮。经常病毒也可以引起糊涂，比如病毒会引起脑膜炎，那我们一定就是要排除病毒。然后呢，药物也有副作用，比如激素可以引起精神的状况，有些药就像 Plaquenil 有时候会引起情绪变化，病毒比如cocaine 可以引起中风，有些病人他们是从小就有精神病，和红斑狼疮无关，而且有些机遇呢，他们是因为是对这个诊断而感到机遇。So I think that's why it is really important for diagnosis is that we want to do a workup to make sure that the symptoms are from active lupus in order to guide our treatment. So one thing we often do is we assess the overall lupus activity. Patients with active lupus affecting the nerve system often have other symptoms of lupus, such as joint pain and swelling, malar rash, hair loss, mouth sores, to give you clue that this patient's overall lupus is active. You want to check labs such as complement C3, C4, double-stranded DNA, and the urine studies. A low complement and elevated double-stranded DNA is a sign of active lupus. It's very important to rule out infections. So we oftentimes do a lumbar puncture to rule out infections and other causes of confusion and symptoms. We also image the brain with a CAT scan or MRI to look for signs of abnormalities. You can do an EEG, like a brain test here, to look for seizures, and we do a nerve conduction test to look for objective signs of nerve damage. 我们做针顿的时候，我们先需要针顿这个它的这个 症状是不是从红斑狼疮，因为这可以指导治疗。比如我们先看看他有没有任何其他红斑狼疮的症状，他有没有手和脚肿和痛发炎，或者是有没有皮肤有没有症状。然后呢，我们可以查血和尿来做检查。如果红斑狼疮很活动的时候呢，complement C3、C4 和 double strand 会降下来，double strand DNA 会上升。然后呢，我们要做腰部穿刺来排除感染，这个非常重要。然后脑部做个 CAT scan 和 MRI 的扫描，可以做点脑电图，然后神经的这些，你去查查是不是有神经的状况。So if we determine that the symptom is from active lupus, then how do we treat it? If we think that there is a component of inflammation in the brain or in the nerve, one of the very first thing we do is we give steroids, which can act fast and make the patient feel so much better. And the other long-term medication to consider are immunosuppressive or medication that suppress the immune system, such as cyclophosphamide, rituximab, or CellCept. Other time is IVIG and plasmapheresis. If we think there's a component of clotting, such as if we see stroke, then we would want to give them a blood thinner, such as Coumadin, baby aspirin, antiplatelet medication, and we want to modify the cardiovascular risk factors, including blood pressure and high cholesterol. 如果我们觉得它的症状呢是红斑狼疮而引起，那我们怎么治疗呢？如果是脑部发炎，那我们就要给激素，给免疫系统的药，药能来控制这个免疫系统，就是激素。然后还有这几个药，我中文不是很会说，但英文就是 cyclophosphamide, rituximab 或者 IVIG。如果他们就是有中风啊，或者有血栓形成啊，那我们就要抗这种的药，抗凝药，就像 aspirin 或者 Coumadin， 然后要降低心血管危险因素。However, like I said, not all symptoms are from active lupus. Then if we determine that the symptom is not from active lupus, then we should focus on providing supportive care. If a patient is anxious and depressed, then we can give some therapy, family support, and at the same time, give them antidepressant medication that help with mood. At the same time, we will work with the neurologist to provide seizure medications. We want to modify risk factors for stroke, control the blood pressure, the cholesterol, and heart disease. Oftentimes, if the symptom is mild and then you just have a little bit of numbness and tingling in your hands or feet, then we will give medications such as gabapentin or Lyrica. 如果症状不是因为活动的红斑狼疮而引起，那我们可以应该提供就是supportive 就是对症状的护理就假如就直接治疗焦虑和治疗抑郁，然后治疗单先的药。控制中风危险因素，假如降血压、降蛋白质和心脏病，然后治疗神经的痛，就像 gabapentin 和 Lyrica。然后呢，最后呢，我们讲的就是说，switching back to English, a lot of the disease itself and can contribute to stress and anxiety, and stress and anxiety can then lead to can trigger lupus. So it kind of become a cycle. So things that can lead to that would be a change in appearance, medication, side effect, and pill burden, feeling like you don't want to be a burden. Stigma, having pain and poor quality of life, having fatigue and poor sleep can all lead to stress and anxiety. 很多这些都可以，就像如果有外形改变、药物副作用、不想成为负担、睡眠不好或者疼痛和感到此句，都可以让病人感到压力和感到焦虑。那我们 then how do we and the thing about anxiety and stress is very much connected to autoimmunity. Having stress can trigger a lupus flare. It can be associated with worse quality of life, and more likely patient can have work disability. 压力和焦虑可以引起红斑狼疮的发作，然后呢，他们会有交叉的生活质量，也有可能出现出工作障碍。Then one of the key ways is how do we manage the stress and how do we manage the stress living with lupus? And I want to reassure everyone that most of the lupus, almost all my lupus have good quality of lives, and it's about how to live with it. So one thing is following up regularly with your doctor so that they can keep an eye on you, and to take the medications regularly to prevent flare. And I think it's great that this Lantern community to make you feel that you're not alone, that it's great that everyone's joining the support group. It's really important to share your symptoms very early with your family member, because that can help with early diagnosis. And also to talk about your feelings and share your feelings when you're feeling down. It's important to stay active, and some people use religions to help, and check with your doctor to see what exercises may suit you. 那我们怎么能减低压力呢？就是定期要看医生，然后呢，就是吃红斑狼疮药来防复红斑狼疮的发作。你们并不孤单，我们就比如加入这个 Lantern 是个很好的支持。然后呢，要与家人讨论你们的症状，就可以早一点治疗，谈谈你的感受，与朋友们经常来往，好的态度，然后呢，要保持活动，然后向你的医生讨论你们做些什么样的活动。然后有些人呢，也就是用宗教来帮忙。So exercise really help reduce stress and help with mood and manages the lupus, reduce flare. So these are just some examples, but any kind of exercise that suits you. So Tai Chi, yoga, swimming, or Pilates. 运动可以减少压力，并且帮助情绪，像太极、瑜伽、拉力或者游泳。And I think I'm done. So thank you so much for your time. And this is my practice. I'm located in Elmsford, and I will be happy to see anyone who needs, a lupus doctor.
And I'm so happy to be here.
他是一个临床心理学家，我是孙明倩，然后我是社区科长协调员。然后我们今天会说一说怎么去继续在心理健康，怎么保持我们心理精神健康，和怎么样去让 即使我们患有红斑狼疮，然后怎么继续的在心理精神健康怎么做得更好。
So Shenling and I are coming from Gracie Square Hospital, which is an inpatient psychiatric hospital in Manhattan. And we have an Asian psychiatry program where we treat people with psychiatric disorders who need inpatient care.
我们是来自德瑞斯广场医院，然后我们是负责亚瑞精神科治疗中心，然后我们是在曼哈顿上城到76街，然后我们专门是负责心理精神疾病的住院治疗，所以我们是在医院。
Okay, so we're going to talk a little bit about mental health and chronic illness. And there are a lot of things that affect mental health stress for people who have chronic illness. So it can be anxiety, as Dr. Wong mentioned, even sadness, not knowing when your symptoms might flare up, unpredictable things, and then changes in your finances and even your relationships with other people. Those also add to mental health stress.
然后我们今天会聊一聊心理精神健康与慢性疾病的关系。我们有时候会有来自很多不同的压力，例如是关系啊，然后财务压力，或者一些我们患病了身体上的疾病，或者有时候是我们无法预知的一些身体的状况，也会产生一些心理精神压力的。
So when we talk about Asian cultures and mental health, there are some other things to keep in mind that will add to mental health stress.
然后我们有时候在聊到心理精神疾病的时候，我们的亚洲文化因素也会在里面扮演一个很重要的角色，而影响我们对心理精神健康的一些认识。
So Dr. Wong mentioned a few of these, but people may not know a lot about lupus, right? And so that adds to the stress, right? And if they have some assumptions about lupus, that can also add to mental health stress and anxiety and depression. There's stigma of having an illness and how that affects how you function in your family and in your work and in your home. And a lot of times in Asian cultures, it's hard to ask for help, right? Because we want to be able to be strong and do what we feel like we're supposed to do. And so sometimes it's hard to ask for help.
例如在好像我们有对红疮狼斑的不认识，或者有一些我们的误区，对于红斑狼疮也会造成一些压力啊。然后还有我们亚洲人对心理精神疾病啊，或者红斑狼疮的一些误解，也会造成于我们很多亚洲人都会不去向外界寻求帮助，或者自己藏着掖着，然后就会导致一些心理精神疾病的发生。
Also, just that your day-to-day life gets affected by lupus, as I think you all know. And so there's, just general stress and pain and fatigue and just even being able to go outside because of the sun sensitivity. And then even how you look, gets affected by lupus. And Dr. Wong had a nice graphic of like the rash that can happen. And we know that, there can be some hair loss, and that all affects how you feel about yourself and then your mental health.
因为红斑狼疮的症状会引起的一些焦虑啊、压力，因为它会影响到我们的外貌的变化。好像刚才王医生说了一些，我们会有一些 脸外貌的改变啊，然后因为这些我们会不想要出去，然后还有一些身体因为红斑狼疮而引起的一些身体的其他症状，也会让我们不想要出去，然后也会不和别人交流，所以这也是导致也会有一些心理精神疾病的发生。
All right, so I want to talk a little about just mental health in general and to make sure that if you are having stress or anxiety or depression because of your illness, you are definitely not alone. And so as much as 70% of people with a chronic illness like lupus actually do have mental health problems.
其实焦虑症、抑郁症是很常见的一个心理精神疾病，也有一些因为慢性疾病而产生的一些心理精神疾病是很普遍的。在我们可以看到一些数据，就是有多达70%的人都可能患有心理精神疾病，例如是焦虑症啊、抑郁症，所以你并不是自己一个。还有很多人都是跟你面临的同样一个疾病。
So when we talk about mental health, what is it? What does it mean? So mental health is actually mental and emotional well-being and feeling good, generally good about life, even though you might have stress.
我们经常就会提到说什么是心理精神健康，它其实就是一个指出一个是心理精神层面跟你的情感情绪一个健康，就是例如如果我们今天感到很多压力，可是我们仍然可以应对这些压力，然后适应这些压力，并不会因为压力而感到一些不开心，而导致一些心理精神方面的疾病。
So mental health is not having no problems at all or feeling happy all the time or always having positive thoughts or being perfect.
心理精神健康不是说我们一点问题都没有，然后我们有时候会生活很多事情会发生，我们没有办法是长时间一定会感到开心的，或者我今天一直都有很积极的想法，然后强迫自己做完美的人。
So when does your mental health become a problem? And this is a question that we get asked a lot, is sometimes I feel anxious, sometimes I feel a little sad, but when is it a problem? So your mental health becomes a problem when how you feel makes you think, feel, and act in ways that are not helpful for you. And when it's hard for you to go about your daily life. And it can be affected by genetics, brain injury, biochemistry, or traumatic experiences.
然后我们会经常被其他人问一下，什么时候心理健康会变成一个问题？就是如果你的大脑功能会产生一些很负面的影响，而这种负面的影响或情绪已经干扰到你的日常生活中，例如你无法出门，无法做一些正常的事情，就是平常你做的事情，你无法再继续，那就会是一个问题。然后它可以因为是遗传脑部的疾病或脑损伤，或者是大脑里面的化学物质产生的变化，或者有一些突然的创伤经历引起，然后它就会变成一个心理精神疾病。
So keeping in mind, mental health is not because of bad parenting. It's not something that you can just get over it. And it's definitely not because you're not good enough. And these are things that we hear a lot from people. So I always want to talk about it because I want to talk about the myths about mental health.
心理精神疾病有时候，可能父母会觉得是不是他们没有很好的教育他们的小朋友，他其实不是，他是与你的教育方式是没有关系的，它也是不是一个就是说你可以容易去克服的一个问题，它是一个 疾病，所以需要一些专业的帮助，也不是因为你不够好，它只是一个疾病，所以就是跟你个人的行为是没有关系的。所以因为很多人有时候会对心理精神疾病有一个迷失，究竟是什么？是因为我自己的问题，还是因为我做的不够好？所以他们也会有这个问题。然后我们今天就会想说一说这个迷思这样。
All right, so I do want to talk about mental health and Asian Americans, because our group actually has the lowest rates of mental health care. And so because of that, there's more and more effort in the United States to include Asian Americans in mental health services. And a lot of organizations are actually expanding their ability to provide mental health resources to people in different languages just so they can get more mental health care.
你可以看到，我们这里可以讲到一个亚裔美国人与精神健康的服务。然后你看到图表旁边，就是我们亚裔美国人使用心理精神健康服务是最少的，在一个比率是最低的。然后现在已经美国会有尽力的把亚裔美国人更加鼓励的他们使用一些心理健康精神服务。然后他们现在有提供很多不同的机构，现在会提供不同的针对亚裔美国人提供的社区资源服务，例如是多了很多不同的中文服务或者中文的资讯，然后会给他们一些不同的说中文的一些诊所的资料，所以他们能够更加轻易、更加容易的得到一些帮助。
So if we think about why Asians have the lowest rate of mental health care services, it depends on age and family and their beliefs and, what they think about mental health. So people, a lot of times in Asian communities, people are uncomfortable talking about their feelings. And may feel sort of nervous or angry or scared of how people might react if they start talking about how they're feeling, like feeling anxious or sad. And we all have these ideas about, if I talk about my fears, then people are going to judge me, right? And then finally, the last thing is people may not know what to say to someone else who talks about their feelings. And then they also don't know about mental health resources that are out there for people in Asian communities.
然后我们会讲到为什么会很多人都怎么问题去让我们没法去得到一些心理精神健康治疗服务因为取决于好像他们的年龄文化程度、家庭文化或者他们的信仰。然后在我们亚洲人，我们是比较没有从小就是没有学到一个就是怎么样表达自己的感受，我们都是把自己的感受藏在心里，是不跟别人讨论。有时候是因为我们很害怕别人对我们的看法，或者别人会不会，如果我们表达了自己的想法之后，他们会不会因此而对我们就是一些不好的评论或者会不会我们很注重自己在别人眼中是怎么样的人，所以我们就不会很过多的讨论一些自己比较深入的不好的情绪或者负面的情绪。而且因为我们对心理健康的不认识，然后会有很多一些不同程度的污名化，就觉得如果你被别人知道你有心理精神疾病，你就可能变成了神经病，他们会怎么看你？他们会不会疏远你之类的？还有另外一个原因是，当你跟别人开启了这个话题之后，如果你真的身边朋友需要一些资源的话，你可能不知道，因为你对这个资源也是一无所知，所以你就可能比较害怕的找这个话。所以这也是因为其中的原因，为什么我们很难去得到一些心理健康进行治疗服务的一些讯息。
So two things I want to talk about specifically are very common mental health problems for people who have lupus and other chronic illnesses. So anxiety. When sometimes we get a question of what is anxiety? What does that mean? And so essentially everybody experiences anxiety in different ways. And it could be just feeling scared or nervous or tense, or sometimes people feel it physically. So it's like, racing heart or hard to breathe or feeling sweating or headaches, even upset stomach or urinating a lot. And a couple of, if anxiety becomes a major problem, here are some possible diagnoses that your doctor may give you. It could be post-traumatic stress disorder, obsessive compulsive disorder, panic disorder, social anxiety, or phobias.
我们也会有感到焦虑，然后焦虑会有不同的一种表达方式，每个人都不一样，感觉有些是可能紧张烦躁，有些是可能胃部不舒服，然后是不同的。然后如果你更加非常焦虑的话，医生可能会给你的诊断可能是创伤后遗症，或者强迫症、恐慌症、社交焦虑症恐惧症。
Another major problem that comes with along with chronic illness is depression. And again, we also get questions about what is depression. So depression is basically feeling sad or hopeless, or even having no energy and interest in doing things. Physically, you might feel some aches and pains. So again, with chronic illness and lupus, you might feel aches and pains because of that, but you might also feel aches and pains because of depression. And then changes in sleep and appetite. And extreme cases, you may be thinking more and more about death. So your doctor may diagnose you with either major depression or bipolar disorder.
抑郁的症状就是你感到悲伤，然后非常绝望，而且没有动力去或者没有兴趣，就是你平常喜欢可能去和你朋友出去逛逛喝茶，可是这些你都不想再做，然后你会感到很痛然后睡不着觉。这个有时候也可能是抑郁的症状，也可能是红疮狼斑的症状。如果你到了抑郁非常严重的时候，你的医生可能会，如果你去看心理精神科医生，他们可能会帮你诊断为可能是重度抑郁症或是躁郁症。
So one thing I want to mention is that people who do have problems with their mental health, they sometimes turn to drugs or alcohol to help cope with their negative thoughts and feelings. But there's a lot of research that shows that drugs and alcohol actually do not help at all and actually make your mental health problems worse.
有时候很多人他们就是当他们有心理精神疾病之后，他们会可能酗酒或者滥用药物来减低他们对心理精神疾病那个不舒服的感受或想法，或者是使用他们来逃避一些他们的不想面对的一些事情和感受。但是实际很多研究报告指出，毒品跟酒精不会帮助你们去应对这一些负面的情绪，他们只会让你的心理健康心理精神健康的问题更加变得严重跟恶化。
And one thing I always want to talk about when it comes to mental health is suicide, especially people with chronic illness who feel like there's no end to their suffering. They might start to think about suicide. So about 90% of people who do die by suicide have mental illness. And most of the time, the reasons are actually to end how they're feeling and feeling hopeless and helpless that anything can change. And also keeping in mind that mental illness like depression actually prevents people from seeing that there could be a solution. So if you or anyone you know have any suicidal thoughts or behaviors, that please do think of it as an emergency and call for help.
今天我们会提到一个自杀90%的人因为自杀死因为患有心理精神疾病自杀的人，因为他们非常绝望，然后很无助，他们也可能没有寻求到帮助，他们就会因为这种感觉太难受，他们就选择结束自己的生命。有时候因为他们非常的绝望，他们没有看到更好的解决方法，例如是寻找一些专业的治疗啊，我们待会会提到的。然后如果你有身边认识的朋友、亲人，他们有一些自杀的想法或行为，我们会认为这是一个心理精神疾病的紧急状况，那你要帮他们打988或者911，然后会把他们可能送到急诊室，让他们可以得到更好的治疗，去挽救他们的生命。
So how do we keep our mental health? How do we stay mentally healthy? So really from the start, just take care of yourself. Sleep well, eat well, exercise, don't watch too much TV, keep a routine, go outside every so often, and really do things that you like to do. Because if you're able to take care of yourself and do things that you enjoy, that all adds to your physical, mental, and emotional health.
那我们怎样保持我们的心理精神健康呢？就是首先是有规律的生活吃好睡好，然后好好的享受自己喜欢做的事情。有时候我们不建议看太多的电视或者网络资讯，因为你有时候看到不好的新闻会造成自己心理压力，你就会不开心，因为你非常的担心什么事会发生。然后我们建议如果可以的话，多去户外走走，就是可能到公园那里走走，跟朋友一起聊聊天。那只有你享受自己喜欢做自己做的事情，你才会感到开心，那你才可以保持到你生理跟心理上的健康。
So here are some tips on how to cope with stress and anxiety. Again, I said doing things that you enjoy doing, including listening to music or exercise, doing art, just anything that you enjoy doing, because that helps reduce your worry and negative thoughts. I mentioned avoiding alcohol and drugs. Even doing like deep breathing exercises can slow you down, because if you're feeling anxious, you might notice that you have racing thoughts. And so deep breathing and other slower activities can help you calm down. And, of course, everyone in this group, benefits from Lantern, but also I just want to say looking for help from support groups and other people. And especially notice if you're thinking negatively about things, and instead think about things that you can control.
那我们怎么去应对压力跟焦虑的技巧？就是听听音乐，放松心情，锻炼身体。好像刚才王医生说的，太极啊、游泳啊，这些都可以帮你舒缓一些紧张的情绪。或者有些朋友喜欢画画唱歌的也是可以或者寻找一些其他爱好，那也可以帮你转移你的那个担忧跟负面的想法。然后就是避免酒精跟毒品。然后我们很多朋友有参加这个Latin 的支持小组，然后你可以再参加不同的支持小组，然后他们可以给你聊聊天，然后抒发一下自己的情绪。然后如果当你自己意识到有一些负面的情绪的时候，就尝试一下不要专注在这个负面的情绪，想一想其他你自己可以控制的事情， 简单，例如是你今天晚上晚餐、午餐吃什么这些轻易的事情。然后我们会鼓励你们去做一些深呼吸的练习，或者用一些我们叫做压力球。当你很紧张的时候，就数1到10，要呼吸，然后这也可以帮助你减低你自己的的焦虑的情绪。
So one good question to ask yourself all the time is, how can I think about this in a more helpful way? Right? So if you're noticing that you're thinking negatively, how can you think about it in a different way? Like, what can I do about this instead of I can't do this?
当你可能有时候有个问题，当你很负面的时候，你可以想一想，我怎么可以，不要专注在他的问题上。有时候我们会转一转方式，想一想怎么会有更好的解决方法？怎么更好的有一种更好的更解决方法，或者我可以怎么解决这个问题？例如是找朋友之类的，就不要专注在一个钻牛角尖，就一直在想这个负面的问题。
So I'm giving you now some resources. There are some apps on your phone that they're English and Chinese apps that are mental health apps, and also some websites that provide a lot of good information about mental health in both English and Chinese.
这是我们一些我们找到的就是自我帮助的资源，就是在你没有办法像跟你其他寻求外界帮助的时候，这是一些手机上的，左边是我们手机上的一些应用程序，你可以下载，然后你可以听然后可以帮助你舒缓你的情绪。右面是我们一些中文的网站，也是关于心理健康的一些资讯，你也可以上网，然后可以看一看这个会对你有一些帮助。
So, of course, we're going to encourage everyone to get professional help for their mental health. And so the first step is just to tell someone, tell anyone, right? If it's hard for you, if you're having a hard time. You can see a mental health professional, could be a psychiatrist, psychologist, or social worker. And what they will do is talk to you about how you're feeling, right? And it's really important to don't diagnose yourself. Don't say, I have bipolar disorder, or I have, OCD, because they will gather information and provide some help and information. And basically they'll recommend some treatment, mental health treatment, which the goal is to help you feel better and change whatever it is that's making you feel bad and help you feel like you can do better.
我们就是如果当你意识到自己有一些负面情绪的时候，第一你可以跟别人倾诉，对象可以是你的家人朋友，或者是一些你的同事，也是就是你信任的人，你可以跟他们聊聊你的情绪或者你的感受。第二是你可以去看一些心理精神健康专家，他们他们可能是精神病的医生心理学家，好像郑博士，也可以是社工或者其他的心理咨询治疗师。他们会，如果你不知道怎么去说你的感受，他们会帮你去了解你自己，并他们会指导你去抒发你自己的感受，所以不用担心说我去到不知道怎么开始，所以他们会帮助你，所以这个也不要担心。第三个就是你不要自我诊断，因为我们现在听到的、学习到都是不完全，只是一些很简单的资讯，所以不要就是我们今天就是看了学习了一点点，可是真的不是全面的。如果你真的有一些症状的话，要去看专业的精神治疗心理精神专家。然后我们非常的鼓励你们如果你们有需要去接受治疗，因为治疗其实是让你自己变得更好。就是如果你觉得不舒服，治疗是让你 可以康复到一个很好的一个状态。所以不要拒绝治疗，也不要觉得对治疗有什么任何的偏见。
Okay, so I want to talk a little bit about different types of mental health treatments so you know what the options are. So psychotherapy, and that's like talk therapy, and that's talking with a therapist about how you feel and figuring out how to feel better. Your doctor might prescribe some medication for you, and different types of medications can help with different things like anxiety and depression. There are outpatient programs that are affiliated with a hospital. So those could be full or partial day programs. And those offer a lot of different types of treatments, including group therapies. And then inpatient programs those are hospital settings that also offer different types of treatment for more severe cases of mental health problems. And especially if it becomes unsafe for you.
现在我们有这种4种不同的关于心理精神健康治疗的类型。第一种就是我们说的心理治疗，就是你去跟你的心治疗师谈论一下你最近的经历不开心的事情或不开心的感受，他们会带领你去感受一下你自己的感受，怎么讨论，怎么去让别人，怎么可以告诉他你怎么想的，然后他们也会教导你们一些怎么应对，就是当你有负面情绪，你怎么应对它，怎么让它比较不会变成一个更一个很严重的一个情况，然后让你学习怎么去面对一些不同的自己的负面情绪跟想法。然后第二个，有时候如果医生会开一些药物，因为当他们会视乎你的情况去决定你需不需要药物的帮助，所以要看你的医生。然后第二个就是门诊治疗，它就是一种附属于，它不是医院治疗，它是在外面的。他们有时候会有一些支持小组啊，有一些可能是单人的一种心理治疗。然后他就是让不到那么严重到医院的，你就可以去到一些诊所去接受一些比较不同的一些治疗方案这样子。然后第二个是住院治疗，就是你已经非常的严重，或者你已经有刚才我们提到一些自杀的念头然后病人去一个不安全的地方，那他们就会要进入到医院去接受一个短期的治疗。
So if we talk about recovery from mental health, recovery doesn't mean that you feel 100% all the time, right? It actually means just sort of living your life the way you want to live it, even though there's some stress and other problems. Some mental health problems are chronic, but can be managed with treatment, and everybody has a different idea of what recovery means. But the bottom line is there are things that can help you feel better, and that means you can feel better too.
然后我们也会说到什么是康复，然后康复也不是说你已经每天都很开心100%的可以去很开心的去面对生活中的不同的心理的挑战可是你能够去适应它，面对它，并且把这种负面的情绪转化成一种就是如果你有负面情绪，你仍然可以就是慢慢的跟与他相处适应，然后从而从那个负面情绪中不会让你自己钻着牛角尖。然后有一些心理健康问题是难以就是不能是痊愈的，但是可以通过一些药物治疗或者心理治疗来得到一个康复的效果。而且我们每个人对康复都有不同的想法和看法。有一些人可能说，我已经出院了，我觉得我就康复了，我现在能够应对一些不同的问题， 一些不同的负面情绪，我觉得我就康复，所以这是因人而异。然后我们最重要的是，如果你觉得自己有心理精神疾病的时候，不要拒绝接受治疗，治疗是一个你康复的一个非常关键的一个步骤。
So I want to give some information about resources. So these are 3 mental health clinics in Manhattan that provide mental health services for Asian populations.
然后现在是3个在曼哈顿的3个心理精神健康诊所，他们会提供一些心理治疗服务的，他们也会提供中文的，他们都是会说中文的一些诊所。
And these are some other resources. Some are New York City based and some are national. But a lot of them do offer services in Chinese and other languages too.
这些是其他不同的一些资源，他们有些是在纽约的，然后有些是一些比较国家级的，就是全国性的他们都会提供中文服务，就是你可以打电话，有时候你说你需要找人聊聊，所以他们的电话都是可以提供一些中文的临时的一些心理支持、心理健康支持服务，所以你们如果有需要的话，你们可以打一下电话跟他们聊。
And if there is an emergency, or if you or someone you know is feeling totally overwhelmed or in danger, these are hospitals that you can go to their emergency room and ask to come to our hospital, Gracie Square Hospital, for our Asian psychiatry program.
所以如果你知道你的朋友、亲人他们有绝望，或者跟你提到过他们有一些自杀的念头或行为的话，你就要可能拨打911或送他们到急诊室。然后这上面4个都是纽约长老会医院的急诊室。然后如果有需要的话，你就可以叫别人他们跟急诊室说他们需要格瑞斯广场医院，因为我们有提供亚裔的精神服务。可是去医院转接到精神病医院，要看当时的急诊室的医生对你的诊断。就是你进到了急诊室，不意味着你一定会去到医院，所以要看你当时那个急诊室医生对你的诊断。他不是一定会去医院，可是有可能，但是只能是当时急诊室的医生，这是很重要，医生的诊断。所以就到时就要看医生怎么帮你们做出一个诊断。然后如果他们说你需要去医院，你就可以跟他们说你要去格瑞斯广场医院的亚裔精神部这样子。
All right, so thank you very much. I hope that was good information about mental health and lupus and how lupus affects mental health, and resources that are here in New York City for you.
好，谢谢今天我们都来听我们的这演讲。
Thank you to everyone for continuing to learn about lupus and how to live healthier. Thank you for allowing me to spend a few minutes to speak with you again. So with lupus, we all get upset when our bodies don't cooperate. We get angry that so many medications have bad side effects. We get frustrated that family members don't understand. We can feel overwhelmed by all the external stresses, like the financial burdens and the work and school demands, as well as the internal struggles that relate to our culture and upbringing, like the ones that Dr. Wong and Dr. Chang mentioned.
我幫 Karen 翻譯。當我哋嘅身體唔合作嘅時候咧，都會感到沮喪，對藥物嘅副作用亦都感到焦慮。家人唔理解嘅時候，我哋會感到氣餒。有時外在嘅壓力，比如經濟負擔、繁忙嘅工作同埋學業等等，加上內在嘅壓力，比如文化差異同埋成長環境帶嚟嘅困擾，都令我哋感到好失望，甚至不知所措。
These emotions directly influence our physical health. It can trigger a flare and make our lupus worse. Or if you pay attention to your mental health, you can actually change your attitudes and daily behaviors to lower stress and help your body heal.
呢啲反面嘅情緒直接影響到身體健康，佢會令疾病復發啦，或者令紅斑狼瘡發作。其實我哋可以選擇關注下我哋自己嘅心理健康，其實可以選擇嘗試改變態度同埋日常行為，減少壓力同埋炎症，嚟幫助我哋身體康復嘅。
So I grew up in a Chinese family with immigrant parents that focused on working hard, studying hard, and doing what had to be done for your family. So when I was diagnosed with lupus at age 24, I did what had to be done. I read the medical textbooks on lupus, I took all my medications and underwent chemo. The mentality was to get through it, be strong, and don't complain. No need to stop and talk about how you feel.
我係一個華人家庭長大，父母都係移民，有住華人嘅傳統文化，教導我哋努力工作、努力讀書，為家庭創造美好嘅未來。所以當我24歲嗰年被診斷出有紅斑狼瘡嘅時候，我依照父母從小嘅教導，努力咁做該做嘅事情，比如閱讀晒所有有關紅斑狼瘡嘅教科書，服用所有必須要服用嘅藥物，並且接受艱辛嘅化療。當時心想，一定要堅持，唔可以抱怨，堅強唔可以放棄，唔容許自己停落嚟，完全冇顧及到自己嘅內心感受，亦連同朋友傾訴嘅念頭都冇嘅。
I didn't know anyone else with lupus at the time. And even if I did, why would I talk to them about it? Who wants to hear about my struggles? Our Asian culture doesn't prioritize mental health, so it's hard to open up about how you're feeling. And the concept of support groups and talking to a therapist is strange and most likely dismissed, because how is that going to help?
我唔認識其他紅斑狼瘡嘅病人，即使我認識，我都唔會同佢哋講呢個病啦。邊個會聽我訴苦啊？我個華人家庭，我個屋企都從來唔提及心理健康嘅，又唔講乜嘢係內心感受，開心見誠討論一啲都唔慣，覺得好難添。對於社工支持或者同心理治療師交談嘅概念完全陌生，我哋亦都唔會點接受，因為我覺得冇咩幫助。
We're so reluctant to ask for something for ourselves, right? It's ingrained in us to put others before ourselves. As the oldest sister, I take care of my siblings. It's also embedded in our DNA not to burden anyone, as Dr. Wong mentioned. My parents love me. I don't want to worry them.
我從來都唔問自己想要乜嘢㗎，因為我個本能就係先將人哋嘅需求放喺第一位。我係屋企入邊嘅大姐姐，需要照顧細過我嘅妹妹，務求唔俾任何人增加負擔。父母好愛我，我唔想讓佢哋擔心。
But as Dr. Chang also mentioned, we can shift our mindset. With lupus, we can look okay on the outside, but feel horrible inside. I'm okay. Maybe you are. But you know what? You can be better.
我哋其實可以嘗試轉變我哋嘅心態。紅斑狼瘡或者其他長期病患者，外表睇起上嚟好似好好，其實入邊內裏可能好多時候都感到不適同埋疲勞。雖然如此，我哋經常都話俾人聽，我冇事嘅，或者你真係冇事，但係你知唔知道，其實你可以更加好㗎。
How? By realizing that you can control your actions, that you can ask for help, and it's okay. Oh, I don't want anybody owing me, I don't want to owe anybody anything or look bad or inconvenience anyone. But you aren't being selfish when you're focusing on your health. Reaching out actually gives the other person the opportunity to help, and we build stronger connections this way.
係啦，咁我哋應該點樣做咧？首先，我哋意識到同埋要習慣下，請人哋幫忙或者尋求支援係應該嘅，因為咁樣做並唔係話欠人哋人情啊，並唔係話冇面或者麻煩緊人。關注自己嘅健康一啲都唔自私，尋求幫助同埋等人哋有機會可以幫到你嘛。我哋透過呢種方式建立一個堅固嘅人際關係，一個人際嘅網絡。我就係通過呢種方式培養咗更加積極嘅心態。
So don't be afraid to ask and receive help external, as well as help yourself internal. Both are beneficial to your health. And what kind of things can you do to help yourself? Many of them were already described earlier, but I wanted to emphasize 3 healthy habits that I practice all the time. And one, it's having intentional moments. I have morning and evening routines. Every morning I write in my journal 3 things that I'm grateful for. And every night before I go to bed, I write in my journal 3 things that give me joy. Just a quick stop and check in with yourself.
所以大家千祈唔好害怕接受人哋嘅幫忙，同埋要喺內在我哋要自己照顧自己，對健康係好有益㗎。可以做啲咩嚟幫助自己建立健康嘅習慣呢？等我同你哋分享一啲我已經實踐咗嘅方法。第一就係早晚嘅習慣。我習慣咗每朝早上喺日記中寫下3件我好感恩嘅事情。每天晚上瞓覺之前呢，我都會喺日記中寫低3件帶俾我好快樂嘅事情。刻意咁樣停一停，搵少少時間去關心下自己，同埋感受下自己心入邊諗緊啲乜嘢。
And number 2 is having exercise in nature be part of your day. I make an effort to try to sweat every day and go outside at least once to get the body moving and breathing fresh air.
第2個方法咧就係運動同埋大自然啦。我好努力每日都要保持活躍，出一身汗，而且盡量多啲花時間喺戶外吸一啲新鮮空氣。
And number 3 is having multiple social interactions. I meet up with friends in person and have regular Zooms with people who live elsewhere. I also facilitate a support group. So all of these point towards meaningful connections and being engaged with other people.
第3咧就係社交互動啦。我定期安排同家人朋友視像會議啦，同我啲朋友晚餐聚會啊，我仲主持一個支持互助小組。呢啲一切咧都同我建立咗一個好有意義嘅支持網絡。
And having an outlet for your emotions, you know, exercise is a physical outlet, but there are also creative ways to express yourself, like taking photos or singing or playing an instrument.
係啦，做運動可以俾我哋宣泄一啲體力，但係另外咧亦都可以用藝術嘅創作。例如我中意唱歌啊、彈琴啊，做一啲能夠抒發情感嘅嗜好習慣，亦都有幫助。
So yes, this all takes time and effort. And you know, I don't have time for this, but your mental health matters. It's worth it. By paying attention to your mind and body balance, it helps not only your health, but also helps us become more kind and compassionate and have a more positive mental outlook. And that's how I think you can live better with lupus.
係㗎，呢啲一切咧都需要時間同埋努力，但係希望我提醒咗你，心靈同身體之間嘅平衡聯繫至關重要。我哋可以控制思維，可以控制我哋嘅行為， 更好咁樣應對